Hello everyone, I'm Anastasia signing in from NORAS. In today's session, we will be starting with the common investigations where we will be discussing in detail why the investigations is being performed as well as what is their normal values, because as we know that it is only through investigations where we will be able to diagnose the condition of the patient. So here, even before diagnosing the disease condition, we must first perform certain investigations that can be related to the problems that they may be having, and depending on the results which we would be getting from these investigations, we will be able to diagnose the condition of a patient. Here there are various investigations that can be performed, but in this session we will be dealing first with the blood test. So under the blood test, the first which we will be discussing is the complete blood count. Here a complete blood count test can be done in order to check the levels of different components of every major cells which is present in the blood, that is the red blood cells, the white blood cells, as well as the platelets. The important components which could be measured by this test includes the red blood cell count, the hemoglobin, as well as the hematocrit. Normally, these components will be in a normal level. However, if there is an abnormal level of these components, then it may indicate various nutritional deficiencies such as vitamin B6 and vitamin B12, iron deficiency, bone marrow issues, tissue inflammation, infections, heart diseases or various heart conditions, as well as cancer. So here, just by conducting the CBC test, we will be able to get an idea whether the components, which is the RBC count, the hematocrit, as well as the hemoglobin, is in the normal range or not. If there is any abnormal level of these components, then it may indicate the presence of these conditions. Here it is important to note that after any abnormal level has been found, we must make sure that we conduct the various follow-up tests in order to get a correct idea of the cause of the abnormal level, as well as in order to be able to diagnose the correct condition of the patient. Before we even conduct the test or look at the report and determine whether there is any abnormality or not, it is important we must first know the normal value. So here, when we talk about hemoglobin for a male who is above 15 years of age, then their hemoglobin level must be between 13 to 17 gram per deciliter. If the hemoglobin level is checked for a female who is above 15 years of age, then it must be between 12 to 15 gram per deciliter. The hematocrit normal range for a male is between 40 to 55%, whereas for a female it is between 36 to 48%. The normal range for the platelet count, if it is checked for an adult, then it must be between 1,50,000 to 4 lakhs per milliliter, and the white blood cells must be between 5,000 to 10,000 milliliter. So these are the normal values that we must know before we interpret the result of the CBC test. A CBC test is mainly done in order to detect anemia. Anemia is a medical condition in which the RBC or the hemoglobin will be lesser than the normal. And in order to detect this condition, nowadays there is also a rapid testing available where we will be able to check the CBC level. We will be able to conduct the CBC count, and we will also be able to get the results within 10 minutes. So after conducting the CBC count, in men, if we find that the hemoglobin level is lesser than 13 grams per deciliter, then we can diagnose them as anemic, whereas in female, if their hemoglobin level is lesser than 12 gram per deciliter, then we can diagnose that female as anemic. So that is about the complete blood count test. Moving on to the next, which is the serum electrolyte. Here, the sodium, calcium, potassium, magnesium, the chloride, as well as the phosphorus are all the electrolytes. Each and every individual gets these electrolytes either from the food that they eat or the fluids that they drink. So this level of electrolyte in the body can sometimes become too high or too low depending on what we eat or drink. Here, these abnormalities usually occurs when the amount of water in the body changes. So in order to conduct the serum electrolyte test, it is important that we advise the patient not to take any food or water, to be on fast for at least 8 hours before the blood is drawn. And on conducting this test, if there is an abnormal result, then it may indicate presence of kidney diseases, diabetes, or even hormonal imbalance. So here the normal range of serum sodium is between 135 to 145 millimole per liter. For chloride, it is between 96 to 106 millimole per liter. Potassium, 3.5 to 5 millimole per liter. For calcium, it must be between 8.5 to 10.5 milligram per deciliter. Phosphorus, 2.5 to 4.5 milligram per deciliter. And for magnesium, it must be between 1.4 to 2.2 milligram per deciliter. So as I've said, that these are the electrolytes that would be present in the body of a person. So while conducting the serum and electrolyte test, these are the normal values of each and every electrolyte. And if you find that the value for each is either higher or lower than the normal, then it can give us an idea that the person might be suffering from any disease condition. And as we have also seen that abnormal results usually indicate the presence of kidney diseases, hormonal imbalance, as well as diabetes. So here, just by conducting this serum and electrolyte test, we will be able to diagnose the condition of the patient. The next one is the liver function test. The liver function test is usually done in order to check the level of certain enzymes as well as proteins in the blood. Levels that are higher or lower than the normal can indicate the presence of liver problem. So just by conducting the liver function test, we will be able to get an idea whether a person is having any liver problems or not. Some common liver function tests include the albumin, the total protein, the alkaline phosphatase, the alanine aminotransferase, the aspartate aminotransferase, the bilirubin, the gamma glutamyl transferase, the L-lactate dehydrogenase, as well as the prothrombin time. So these are the liver function tests that can be done in order to diagnose or in order to get an idea if a person is having any liver problems or not. Now, when we talk about the albumin and the total protein, here albumin is one of the protein which is made in the liver, and our body needs this protein in order to fight from any infections as well as to perform other functions. So if the level of this albumin and total protein is lower than the normal, then it can indicate the presence of liver problem or damage. The alkaline phosphatase is also an enzyme which is found in the liver and the bones. And this enzyme is very important for breaking down of proteins. So here, if the level of this enzyme is higher than the normal, then it can indicate liver damage or disease. And this enzyme is also very important as it plays a major role of breaking down the proteins. So here, if the level of this enzyme is higher than the normal, then it can indicate liver damage or even diseases such as a blocked bile duct or even certain bones diseases. Alanine transaminase is also called as serum glutamic pyruvic transaminase. It is an enzyme which is found in the liver, as well as it plays a major role in converting proteins into energy for the liver cells. So here, if you find that the level of the ALT is increased, then this can happen because of the liver damage. Here, when the liver is damaged, this ALT will be released in the bloodstream, and because of the presence of this in the bloodstream, it could lead to a level which is higher than the normal. The next one is the aspartate transaminase. This is also known as the serum glutamic oxaloacetic transaminase. It is also an enzyme which helps to metabolize the amino acid Unlike the ALT, this AST is normally present in the blood but in the lower level. So if there is an increase in the AST, then this can be because of liver damage or liver diseases, or even because of muscle damage. The next one is bilirubin. Bilirubin is a substance which is produced during the normal breakdown of red blood cells. This bilirubin normally passes through the liver and is excreted through the stool. So here, if the level of bilirubin is higher, then it can indicate the presence of jaundice, which could be caused because of liver damage or diseases, or even because of certain type of anemia. The next one is the gamma glutamyl transferase. This is also an enzyme which is present in the blood, and if this enzyme is higher than the normal level, then it can indicate liver or bile duct damage. The L-lactate dehydrogenase is also an enzyme which is found in the liver. And again, if there is an elevation, then it can indicate liver damage or diseases. Moving on to the last one, which is the prothrombin time. This prothrombin time is a blood test which is done in order to determine how long does it takes for the blood to clot. So if the prothrombin time is increased, then it can indicate liver damage. However, this prothrombin time can also be elevated if a person is taking any blood thinning drugs such as warfarin. So here, just by conducting the liver function test and by checking all these enzymes, we will be able to get an idea whether a person is suffering from any liver disease or damage or not. So I will be concluding this topic for now, whereby in today's session we have discussed about the blood test, where we have discussed in detail about the complete blood count test, why is it done, what it can indicate. We've also discussed about the serum electrolyte test as well as the liver function test. So I hope you have got a clear understanding of this topic, and I hope you've also understood why each test must be conducted and what are their normal values, and if the value is higher or lower than normal level, what can it indicate. Just by conducting these tests, it would help us to diagnose the condition of the patient. And in order to be able to diagnose the correct condition, it is very important that a correct test must be done, a correct diagnostic procedure must be performed. So I hope you have understood this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.